This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
According to the Philippine Atmospheric, Geophysical and Astronomical Services Administration or PAG-ASA, in the first week of April, the hottest temperature recorded reached a high of 40.1 degrees Celsius in Quirino Province. While everyone is excited to go to the beach and have fun under the sun, we also have to take the necessary precautions to protect our skin from its harmful rays.
Limit your sun exposure. When you go to the beach, you see dermatologists wearing a hat, shades, and under the umbrellas, no? Because we know what the skin can suffer under the sun. So usually it can accelerate aging as well as cause burning. So cumulative burns over a lifetime can also predispose towards certain diseases like skin cancer.
The summer heat may cause certain diseases: melasma, chickenpox, heat rash, sunburn. How harmful is the sun to one's health? How do we protect ourselves from the sun's rays while still enjoying its benefits? These and more tonight on MedTalk.
Summer is the perfect time to hit the beach and enjoy the sun. Tonight, we will talk about how to protect your skin from the sun's harmful rays while enjoying the season outdoors. Joining us is Dr. Wilhelmina Maniquis, a dermatologist from the Asian Hospital and Medical Center. Also with us is Dr. Maria Patricia Chavez, a dermatologist from the St. Luke's Medical Center and the Makati Medical Center. You can participate in our discussion by calling our hotline. You can also follow us on Twitter, post on our Facebook page, or send us an email. Good evening, doctors. Welcome to the show.
Good evening.
You know, the heat is on. It's been very, very hot these days. And a summer obsession is to get a tan. But not everyone is capable of achieving a tan. Why is this? Dr. Maniquis?
You know, there are several skin types from 1 to 6. From the other end of the spectrum, you burn, always burn, you never tan. At the other end of the spectrum, you don't burn, but you tan profusely. So depending on the amount of melanin you have in your skin, which serve as your natural defense against overexposure to sunlight, then those are the factors that you have to consider.
Mm-hmm. So you burn, but you never tan for the pale-skinned...
yeah, for the ivory skin, pale skin, with the blue eyes.
Oh, okay, so the Caucasian and the Americans,
yes,
they just become very red. And to those who get a tan or burn profusely, those are the ones with the darker skin. Yes. So where do Asians fit into the different types of skin colors?
Usually it's in
Dr.
the skin, skin phototype 3 and 4.
Okay, so
yes.
that's the medyo darker. Mm-hmm. Is it in the middle that we get a little bit of a tan and we get a little bit of a red color in our skin?
Yes, it's more or less like that. Right, Doctora?
Yes. Okay. And you know, to achieve this color, we also, of course, have to, as we said earlier, have to expose ourselves to the sun. But the sun's rays are very harmful, you know, because the ozone layer has been depleted already. And so we talk about UVA and UVB. Let's first talk about ultraviolet rays. What is the ultraviolet rays?
These are the rays coming from sunlight exposure. Usually there are two types that reach our skin, the UVB and the UVA. One reminder, so we can remember fast, for UVB is more on the burning, while for the UVA is more on the aging effects.
Oh, okay, all right. So when we purchase our sun protection, and do we have to check for this UVA for the aging and the UVV for the burning. How do we choose properly? Which one do we choose?
We have to check the label. Sun protection factor, or SPF, usually ranges from 1 up to 50 or even 75 to 150. Nowadays, we have those kind of numbers. The sun protection factor usually gives us the length of time that we can go under the sun without burning.
So, Dr. Chavez, let's say we pick up a sun protection formula that's SPF 80. Does that mean that we're protected for 80 hours under the sun?
Not really. Basically, SPF 30 as an international rule, we are okay for at least 1 hour, depending on the brand, but more or less 1 to 2 hours if it's sun protection factor 30. So if you go 80, depends again on the brand and the quality of the product, it may be around 3 hours to even 8 hours. And depends on the skin type. I'm talking about skin type 3-4.
3-4. So
Yes.
how about those with fairer skin?
It would be less in terms of effectivity.
So how often should one apply sunblock protection for these two skin types?
The international rule is for you to get an SPF 30 and apply it every hour. So with that, you're safe. But if you're like working in the field and you cannot do it as often as every hour, then that's the time that you choose to use the SPF, higher SPFs like 80 and 60.
So what are the harmful effects of the sun? I know we talk about protecting our skin, but sometimes we also forget to put our sunblock or reapply it every hour because maybe we're busy. We're busy outdoors, doing outdoor activities. But what are the harmful rays of the sun that we have to remember?
Okay. We can have sunburn, primarily from overexposure to sunlight. There are other skin diseases that we can get from too much humidity and temperature. We can have miliaria, the prickly heat. We can have hyperpigmentation from overexposure to sunlight. We can even have aggravation of acne from sunlight exposure.
And you speak of acne later on. We'll talk a little bit about the acne because during summer we want to bare our skin, but we don't want to have all of those things to show our companions, di ba? But Doc, here on the show we have our Twitter and our Facebook friends who ask questions about, now they're going to ask a question about sun protection and how to keep themselves protected from the harmful rays of the sun. Facebook question from Sheen: I have dark complexion. What SPF level should I use and how frequent should I reapply it? Well, we've talked about that earlier, Dr. Chavez, but maybe we can remind them again.
All right, if you're dark, so I'm assuming you are a skin type 4 maybe, or if you're a little fairer than 3, then it's safe. It's basically hard to remember, but it's safe for SPF 30 every hour. That's safe already. Of course, you have to consider if it's like better with when you're swimming. There are those water resistant,
Yes.
which claims, although some will not recommend that because you have to consider that it's wash off while swimming. But every hour for an SPF 30 is good enough if you just want to remember it easily.
Off cam, we were talking about having a sunblock time, alarm on your phone that you're supposed to apply sunblock, right?
Sunbreak.
Yes.
Yes.
A Twitter question: I got a henna tattoo when I was at the beach. After 2 days, my skin got itchy. What might be the cause of this? That's very popular. You get a henna tattoo at the beach.
Most probably, that patient had contact dermatitis from the henna tattoo that was done on him. So this is not due to exposure to sunlight. This is more of a skin allergy, more of a contact dermatitis from the henna tattoo.
So will it be the shape of your henna tattoo or will it be another shape? So to identify it as the cause for the
It
rash.
is usually localized, so it should be within the tattoo itself or the adjacent area.
Yeah. Would you like to add anything to that, Dr. Chavez?
Yeah, I agree with Doctora. More or less, it will give you the outline of the tattoo. It will not be specifically the same in the pattern, but more or less the same size as what Doctora said. There is like adjacent area redness, but it should not be too larger than what the pattern of the tattoo is.
Briefly, how does one remedy the itch in that area caused by a tattoo?
She can take antihistaminics to control the itch, and she can apply some cortisone cream to remedy the redness and the itch also.
Okay. All right. Another question from Twitter. My face is sunburned. Is it okay to scratch it or peel it off? What could I apply?
I think you should leave it alone.
Don't
don't mess it up.
Yeah.
It's the natural way of the body disposing of the damaged cell, so it will peel off by itself.
So that's also good because there's new skin that's going to come out.
Yes.
And we're talking about being sunburned and not scratching the area. Oh, here right in front of me we have some home remedies for one that has a sunburn. So earlier I mixed milk and oatmeal, and cameraman can, here you go. It has to be like paste, the consistency, am I right? It has to be paste. And you can apply this to one that has a sunburn.
Yes.
Apply it to the area. How often and how much of this?
Well, as a rule, supposedly immediately after the wrist burn, that is for the cooling effect, so that you can control the damage by the heat going deeper into your tissue and having more destruction of the skin. It's not really very often. It's just that as soon as you can to control the heat.
Okay.
Yes, and to control the damage. And it goes with all the rest of the other home remedies. It's more for the cooling effect.
Okay. Cooling effect, of course, ice will do that trick.
Yeah,
Cooling
but not
effect?
too much though. Not too long, and not yeah. If not directly, if ever, like, you know, protect the skin from the direct effect of too much cooling. Because like if it's hot and then there's a drastic change of the temperature and then it's too cold, there will still be burning.
But you don't,
and
do you
damage.
apply the ice directly on the skin, or do you put like a
cloth at least, right, Doctor?
Yes.
on top of it? How about the tea? How do we use that as a sunburn remedy?
You soak the tea bag in a lukewarm water, either lukewarm or cold water, and then you use the water
Okay.
from the soak as compress on the affected area.
Okay.
That is very soothing for sunburn patients.
What temperature does the tea have to be?
Usually it could be cold, but there are some patients who prefer it a little lukewarm.
Or sometimes when you have a glass of water with a lot of ice, you can just
As compress.
compress on the area. And cucumber.
Yes.
Cucumber
Yes,
can
you
also
can
be
use
a-
it as a compress.
All right. Well, we'll talk more about how to protect our skin during the season when MedTalk returns.
Did you know that Al-Zizia in Libya holds the record of the hottest country? The country recorded a temperature of 58 degrees Celsius in 2012.
We're back on MedTalk and we have a caller from Makati City. Hi, Christine.
Hello,
Caller,
good evening.
Christine, this is you. Hi, good evening. Your question, please, for our doctors.
Okay, good evening po. Hi, doctor. Okay. Meron kasi ako mga spots dito sa skin ko, upper part of my body. Yung mga spots, yung red. Itchy kasi siya, lalo pa pag pinagpapawisan. Mga 2 weeks na, including holidays, and until now, meron pa po ako.
Gaano katagal na yung spots mo, Christine?
Halos mag-2 weeks na po siya.
Hello?
Hello?
Yeah, did you come from the beach or hindi ka nag-out of town?
Ako last Holy Week.
Thank you, Christine. Doctors, spots on her body. She just
What color?
came from the... Anong kulay daw yung mga spots mo, Christine?
Kapag bago pa siya, bago lang siya, mga maliliit pa. Tapos later on, mga days, nagiging bilog siya. Red.
Red na bilog na maliliit.
This could be prickly heat or heat rash. Because of the very hot weather and the elevated humidity, usually patients develop bumps, which later on could be very itchy and very uncomfortable for the patient to bear.
And Christine, it's probably heat rash or yung bungang araw. Doc, what should she do? What remedy should she do for this?
You can use cold compress, wear loose clothings that will not touch these skin lesions. Take a lot of shower during the day and avoid touching as much as possible the lesion.
Okay. All right, Christine?
Okay po. Hindi na po ako maglalagay ng mga something na medicine or yung mga cream on it.
You may not do so, but if they are quite uncomfortable already for you, then you can use some cortisone cream, mild cortisone cream. You can try the home remedies that we have discussed earlier.
Okay. How about cornstarch or like a powder-like substance to put on the area? Is that recommended, Doc?
I think just a cold compress will do.
Okay. So, Christine, cold compress para mawala na yung discomfort mo because of your heat rash.
Okay. Thank you po, Doctor. Thank you, Miss Angel.
You're welcome. Maraming salamat din. Okay, so yes, Dr. Chavez, would you like to add anything to that?
Want to add? Well, I agree with Doctora. If the number one basically rash during the summer is heat rash. But then again, if the compress did not work, like a couple of days, it continue to erupt and it's still there and it's becoming more itchy and more red, it's better for you to consult an expert.
An expert.
Yes, after all of these things, this home remedy that we've discussed, and it's still there, then better to consult an expert.
How long after applying home remedy should one consult an expert already?
Well, for me, like a few days, like a couple of days, let's say 3 days, and it's still there. Just been having it like 1 to 2 weeks already, right?
Yes.
So I guess more than 3 days, you should consult an expert already.
And during the summer season also, doctors, you know, aside from sunburn or maybe a heat rash, we also notice a difference in our the skin tone. Maybe we sweat more, or maybe we're more oily. So now let's talk about the different skin types and what happens to these different skin types during the summer. Maybe briefly, let's talk about normal to dry skin. Dr. Chavez? Go ahead.
All right, normal and dry skin. Pretty much if you are like genetic, it's inherited. You basically have dry skin. Even if it comes to a point that it's summer, that you sweat a lot, supposedly you will be producing more oil. Then again, since genetically you're dry, then you won't be having that as much as the normal skin type. So for the normal skin type, you don't need to do anything. Not too much lotion because there's innate oil you will be producing on your own. Now, if you're oily, that's where the problem is because you will be more oily. Okay.
Are we prone? Are those who have oily skin more prone to acne or bacne or other skin disorders during the summer?
Yes, if you have an existing acne already, then you sweat a lot during summer, then that will aggravate the production of oil in your skin. On top of that, you have a lot of sweat being produced also. So this aggravate the acne problem.
So how do we prevent having more acne during the season? Because this season we want to show our body, show our skin, and we don't want the sight of acne around there. Go ahead, Dr. Chavez.
Well, pretty much because oil is the culprit in having an acne. Oil plus the cluggers, and that's the dirt and the dead skin that is being irritated by too much oil and too much sweat. So number one is to keep the skin clean as frequent as you could. So like what Doctora said earlier, take a bath as often as you could.
Okay.
Yes. And then the kind of soap that you're going to use is also very important. Like if it's like you're trying to clean a very oily skin, then you can probably use a soap that is non-moisturizing. It's more of like hypoallergenic mild, but more of like drying than moisturizing soap.
So this is for oily
regardless of the
skin.
brand.
How about
Yes.
for dry skin? What do you recommend?
For dry skin, you should use as much as possible soap-free wash, so that being dry already, if you use an oil-based product, then the more you will aggravate your acne problem.
All right, we go back to our Facebook page. A question from Eliza or Eliza. What should I do if I think I have a boil?
If you think you have a boil, try to keep the area as clean as possible. Avoid touching it, because one way of transmitting it is through skin-to-skin contact, through fomites. So you try to consult a doctor as much as possible, so you will be advised on what medicine to take, what medicine to apply, so that you will avoid the complication of untreated boil.
How do we describe a boil? Is it itchy? Is it, how is it? Is it painful?
It's more of painful rather than itchy. It's edematous, it's swollen, reddish, and basically painful when you touch it.
Okay, so there's pus. There's pus inside,
coming out, yes.
from the boil. Because sometimes you can't differentiate a boil from chickenpox or maybe even a heat rash. So from what you just mentioned, basta a boil is painful, and the two others mentioned are itchy.
Well, there are certain characters of the lesions that will differentiate each diagnosis. So being used to seeing these skin problems, once you see one,
You'll know it
it's
already.
easy to diagnose it.
But for the individual who may have it right away and may tend to maybe scratch it because they don't know what it is, then maybe it would be best to consult a doctor right away.
right.
So maybe briefly, just briefly, you've described the boil. How about chickenpox?
Chickenpox is a viral skin infection. Once you have it, then you're free from it for the lifetime. No? Okay, it usually presents initially as a red bump, getting into a blister, and then with crusting later on. So you usually have signs and symptoms before the rash appear, like fever. You can have cough or colds or some feeling of tiredness.
Okay. How about, well, we mentioned already prickly heat.
Yes.
Or
Well,
heat rash.
All right. Well, for the heat rash, this is the most common. The rash is very little and very distinctive. It's like generalized. When you say generalized, it's like all over a certain area that is occluded with sweat. And they're little bit, but usually you feel the itching first before you see the redness. As compared to the chickenpox, which Doctora described fully well, this is like many rash at the same time popping out. While the chickenpox, like 1 or 2, and then within 6 hours, a couple of it already, and then another 6 hours, it's like all over the place.
So it's all over the body.
It could be all over the body.
The
Whereas
heat rash can be like in
on
particular-
occluded areas or the sweaty areas alone, yes.
All right. Okay, thank you, doctor. Another question from Twitter. My work requires frequent sun exposure. Is it true that frequent sun exposure can cause melasma? Maybe before we answer that, let's first describe what melasma is.
Melasma is usually described as a patchy discoloration, usually on the face, on the sun-exposed areas, usually on the upper chin, upper lip, cheeks, the forehead, even the tip of the nose. You can have this disfiguring coloration of the skin.
What color is that?
It can be tan, brown, light brown, could be bluish gray or grayish in color.
Is that affected by, like our Twitter question, she has a lot of sun exposure because that's what her work requires, so she could have melasma already.
Yes, the exact cause of melasma is actually unknown, but one of the leading causes is overexposure to sunlight.
Okay, so what advice could we give our friend from Twitter who asked about that?
Avoid sunlight exposure as much as possible, but if you can't, then you have to protect your skin by wearing sunscreen or sunblock.
Sunscreen, or maybe if possible, to wear a hat also.
Yes.
Wide-brimmed hat.
Wide-brimmed hat. You know, sometimes kasi, you know, well, it can be a trend also to wear a wide-brimmed hat, but sometimes you know, you're being teased because hindi ka na makita under your wide-brimmed hat, but you can always explain that, you know, you're doing that to protect yourself from the sun. Being very responsible also in taking good care of your skin.
And to add,
yes,
for
please.
protection,
yes, please.
To avoid anything that will enhance photo activity or photosensitivity, like anything scented. If you're under the sun most of the time and that it's a trouble for you to put sunblock every now and then it also will help you if you will avoid like photosensitizers. These are the chemicals that can add to the burning of the skin and even tanning, like anything scented. That's why go for a hypoallergenic, mild, unscented soap. Avoid colognes and perfumes as much as possible. Even for your sprays, like hairsprays and all of those things, if you can use anything that will not be too scented, will also help in terms of the burning or the tanning.
How about this one? This is a Facebook question from Malubel. How do I protect my lips during summer? It's starting to crack and dry.
You can protect, you can protect your lips by using lip balm or lip moisturizer. You can even put sunscreen on your lips before you get out under the sun.
Dr. Chavez?
Yes. Particularly, there are lip balms with sunscreens already, and there are lip balms where, again, hypoallergenic without any scent and flavoring. They are favorable over those with a lot of other flavors and scents.
Again, so it's always wise to keep ourselves protected, apply sunblock every time, wide-brimmed hat or sunglasses.
Yes.
Everything and anything you can do just to protect our sun. A scarf also, right? And we protect ourselves from the sun. At the same time, we can also get a tan, right?
Yes.
Because that's the main goal during the summer. But protection is #1 still. Thank you very much, Dr. Chavez. Thank you very much, Dr. Maniquis. Again, I'd like to thank our guests for sharing their expertise on summer skin diseases. Again, thank you to Dr. Wilhelmina Maniquis and Dr. Maria Patricia Chavez. See you again next Tuesday on MedTalk as we talk about another summer concern, heat stroke and dehydration. 10 p.m. on your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night.